Okay, I trust that everything else is in place here. We want to get started because we do want to allow as much time as possible. I particularly am very excited to attend this particular breakout session, and it's my privilege to be able to act as host for this for two reasons. One is the topic and the other is the presenter. And the topic, I believe, is extremely important because I believe that governance forms the foundation of so much of what we do in our health ministry, and it's so critical to how we can improve our health ministry in so many areas of the field. Time and time again, I think this has proved that once we get our governance in order, a lot of other things can move from that. But I particularly appreciate that we have Dr. Mwansa coming here and speaking to us on this topic, because not only does he have vast experience, he has a lot of experience chairing boards. We were going over it beforehand, and he's started out by, some of the first places he chaired was at the hospital down in Zambia, where he worked, where he began much of his career. He was chairman of the board for Mwami Adventist Hospital, Yuka Adventist Hospital. He's also been chairman of the board for schools, particularly our new Adventist University in Africa, brand new one there. Before that, he was chairman of the board at Salusi, and then also at UEAB, the University of East Africa at Bariton. And currently he's also chairman of the board for the Hope Channel. So he has a wide range of experience of different kinds of organizations, including our health work that we have been talking about. He's also sitting on our board for AHI and many other boards. And so he has a lot of experience. And I appreciate the fact that he also can bring us the particular perspective of someone from in the field who has been out and lived and indeed is African. And so I particularly appreciate that. So I want to turn as much time over to him as possible. We'll let him begin now. While he's coming up, I would like to add that he has decided that we definitely want discussion. And so we are setting aside the last 15 minutes for this discussion. So if you can keep your questions, make notes on them, give them to us at the end, we would really appreciate that. And we'll have a couple of mics going around so that we can have some discussion about this afterwards. Pardon, Mwansa, thank you so much for coming today. I look forward.
Yes. Okay, good.
There we go.
Okay. There we go. I knew something was not okay. Again, good morning and welcome. Those of you that attended Dr. Hart's speech last night, it was such a valuable and keynote address that I would like to build on one of the points that he mentioned. To give a recap of this in 1 minute, he first of all shared how we as a church had begun with hospitals that were appreciated and were the premier hospitals. And you can tell that by the number of embassies that come for treatment at your clinic. When you go to our clinic in Djibouti, when you go to our clinics in different countries, if the ambassadors of different embassies come there, then you know you provide quality services. Then in his presentation, he swung to how we have gone down to the point where our hospitals are no longer reflecting that. Then toward the end of his presentation, he outlined some of the things that we need to do for us to recapture our initial image. He mentioned, among other things, he said we needed a new system of governance. He mentioned we needed a new system of boards. He mentioned we needed a new system of donors. He mentioned several new systems. This morning, we're going to focus on one of those, which is just a look at how your boards can enhance the outcomes of your institutions and organizations. Now, I must admit at the offset that it took me over 20 years working for the Seventh-day Adventist Church to understand our board systems. Obviously, you would be amazed now if it took me 20 years now. Most of you are likely to be quick learners and may have picked it much earlier. But it took me over 20 years, and in those 20 years, I served as union president, chairing Yuka board, Mwami board, and other boards, but I really did not understand what boards are supposed to be like. And you will pick it as we go along the presentations. It has taken me the past 12 years when I now began chairing those boards that became complicated because they were tied to national affiliations. They were boards of institutions that had their own bylaws, and along the way, I picked up some of the lessons that I'm going to share with you. One of the things we want to accomplish in these meetings is to find a way of how your hospitals or clinics can work in a manner that will make and restore Adventist hospitals to premier hospitals wherever it is you are. Now, if you are familiar with the Seventh-day Adventist systems, we have two systems, and I'm putting the two systems on the screen. The two systems that we have, I'll let all the bullet points be there, and then I'll make comments to them. When I first began working for the church as a pastor, I was used to only one system, the ecclesiastical system. And I owe to Elder Lowell Cooper the summary of these points in one of his presentations. Now, in the ecclesiastical system that I was used to, when I was appointed as a committee member, I would go to the conference meeting, and when I would go to the conference meeting, we would make decisions, then we would refer some decisions to the Union Executive Committee. Sometimes they would refer the decisions to the Division Executive Committee. That system became so much part of me that when I was exposed to boards, I struggled to understand the difference. And as a result, I found myself handicapped in maximizing the value and the role and the importance of boards. So let me review quickly with you the differences. You will notice that the first difference in the ecclesiastical and the institutional system is that we use the executive committee system, and here we use the governing boards. In the ecclesiastical system, this is part of the chain. Your committee is part of the chain. How does the chain go? You have the Conference Executive Committee, it's a chain in the Union Conference Committee, it's a chain in the Division Executive Committee, it's a chain in the General Conference Executive Committee. Your committee system is a chain, and they are interrelated. Sometimes you can't conclude a decision on a matter because the chain says, wait for us. The opposite. The boards are a stand-alone entity. Now, just to understand that, is in itself a milestone in how you approach the boards. Boards of institutions are stand-alone. As a matter of fact, and if it's an incorporated board, institution, the decisions you make in your board are final. They are not referred to the executive committees and no, let's contact the division, no, let's contact the this and that. No, they are stand-alone. Now, the second part is many people usually work with the executive committee. You will find that because it's a chain, there are many people who have say. There are many people who can say, no, this was wrong. Too many people. Here, very few employees or very few people, because of the stand-alone nature. One would give an example, for example, in the country of Zambia, we have different boards. Mwami board, Yuka board, if we have that. The two stand alone and make decisions independent, unless, of course, they form one board. Now, the third one is the chair for the ecclesiastical system is from internal, meaning you have a conference president, he is the chairperson. He belongs to the committee and he is the top. So the chair can actually dictate. The chair, who's also the senior most in the executive committee, can dictate what should come to the board, to the committee. The contrary to the board, the chair from the boards is an external. You will notice, for example, Dr. Richard Hart, who is the CEO of the Loma Linda board, the Loma Linda system, the schools he described for us yesterday. He's the CEO, but the chairman of the board, Elder Lowell Cooper, is an external person. He doesn't work for Loma Linda. He comes from outside. I am chairman of Hope Channel. I don't work for Hope Channel. I am from outside. I'm chairman of Adventist University of Africa. I come from outside, but I chair that. Now, this is a major difference. As we will look at how this works, you will notice that just to have somebody who is external make up the board in itself changes the nature of even the decisions that you make. And then there are 3 officers elected and they are accountable to the executive committee. When you take the conference executive committee, there are 3 people, senior officers, who report to the executive committee. But when you take the board system, the CEO is the primary person accountable to the board. In the Loma Linda board, for example, the secretary of the board would be Dr. Richard Hart. That's the president of the institution. In the Hope Channel, Brad Thorpe would be the secretary of the board. He comes alone to represent his entity. He stands alone and he is held accountable for the activities of the organization by the board. The next one here is they are more involved in management under this, and they are less involved in management here. This one is unincorporated and this one is incorporated, and that in itself defines how they stand. They stand on different bylaws. They don't have the chains. Now, before I move from this slide, because this slide is so important, and I want to pause and speak a little on this slide. There are some here who are in church leadership. For example, conference presidents, union presidents. I can see some in here who are from the ecclesiastical system as leaders, and they are asked to chair in the board. One of the things that will help us, and this is important and radical, one of the things that will help us is if the chairs of these boards would make a distinction between the 2 systems, so that when they go to chair the boards, they go there outside of the ecclesiastical system, even though the hospital is an Adventist hospital. To just do that, to put on that mental cap and say, this is what I am when I go there, it immediately makes you an effective chair of that board. Now, I would like us to now go through the different things about a board. In the presentation, I have tried to outline the critical blocks. First of all, what are the responsibilities of a board? Secondly, how does the board relate to the CEO? That's the first officer of that institution. And then thirdly, how do you make a board an effective, good board? Now, there are boards can be interesting. The first board that I attended, and I won't say where, when we got there, the board did not last for 1 hour. It got so hot because 2 physicians fought in the hospital, physical fighting, which came to the board, resulting in suspending everything at that hospital and replacing and putting an ecclesiastical person to supervise the hospital for a year. Now, that's a board. That was an active board, I must say. Now, the point I'm making is, it is important for us then to understand these 3, and they will be the central focus, the responsibilities of a board. And then the second one, how do you relate to the CEO? And then the third, which will be, how do you have healthy boards? I'm going to skip those things that I know we can skip on. I had wanted us to do some group works, but I'll still put them there on the board. You have them in your bulletin, in your handouts, in your papers. You do have those. But I want to say a comment on this before I move out of this slide. One way for you to understand a board is to imagine that you have been tasked to go and take care or be responsible for an amount, and you are standing outside, but you are assigning it to somebody. You know, there's a word that was left there. I think it's me. I don't want to blame my secretary. Secretaries get blamed for all mistakes that are left out. But here is the point. When you are approaching a board, look at it as people who have decided to entrust something huge to another group of people, but you are responsible for the outcome of that group. So in the light of that, I'd like us to look at this first. Governance of the institution rests in its governing board. I have put the word missions there in red because you as board members, when you go to the board, you do have a vision as a board. You do have a mission as a board. That mission, the fulfillment of that mission does not rest on the shoulders of the president of that hospital or on the staff of that hospital. The responsibility rests on you as board members. And you will learn together with me how that is so. You are responsible as board members. If the institution is failing, you are responsible. If the institution is thriving, you receive the credit. The board responsibility, one of those, is to develop a strategic direction for your organization. A strategic direction is something that you as board members define. I'll give you a simple definition of that. In your board, together with your chair, whoever the chair is, you define and say, we want to see a hospital that is made a number 1 hospital by choice. So that when people are looking for the hospital of their choice, they will select us as a hospital because, number 1, we will be the most friendly people in our hospital. Number 2, we will have the best equipment for our hospital. Number 3, we will have the best facilities for our hospital. Number 4, we will have the best medical doctors or nurses for our hospital. Because we are going to have the best of these, we will rank in our community as the number 1 hospital by choice, by the people who look for medical care. That's a vision that you create as a board. That's a vision. You as a board act as the owner. Your constituents, whoever they may be, would be the owner. But if a task to you as the board, you are the ones who are saying, this is what we want to be. You need to clarify that. You need to say that. Now, can you imagine if I am CEO, or if you are CEO, the first at that institution where the board is responsible for, they tell you and they say, we as a board would like to see a picture of this hospital, Haiti Hospital. I was in Haiti 2 months ago. We want to see Haiti Hospital to be the #1 hospital of choice in this country, because it has the most pleasant employees, because it has the best practicing physicians and nurses, because it has the best equipment, because it has the best facilities. When you describe that, that's a description of the board, then you will see, as we continue, just how the CEO picks up that. When you do that, then you have to select the CEO. Let me talk about how important this is. When you have just defined your vision, like I stated it, a vision of the premier hospital in the country, your next question is, who can best bring about, from a practical point of view, this articulated vision? Who can do this? Who is capable? So you look now for a woman, or you look for a man who will best carry your vision out. Now, beloved, I want you to look at this. This is where things break down. A board can be as good as they can and articulate a vision. If they make a mistake on the selection of a CEO, all their plans may not be realized, because they depend fully on the CEO. All the board members don't work for the hospital. There's only one who's present there. That's the president. So when the rest of you go from the board, it's only the CEO who is left to implement. One of the key roles of a board is the selection or the election, whatever it is you will call it, of the chief executive officer of that organization. Some organizations go to the point of actually forming a search committee. A search committee to really search for this person, the #1 person. Because if you don't have the right person, you've just crippled yourselves. We just finished electing the ADRA president for ADRA, Adventist Development Relief Agency. A search committee was formed. There were names. The lists were reduced to finally 2. But that's after intense interviews of knowing, can this person carry out our vision? That's one of the responsibilities of the board. And then obviously, you're responsible to give that CEO a budget he can work with to realize the vision. I need to mention this. One of the weaknesses we have in most of our hospitals around the world, particularly in the developing nations, is that we will find the best person. Sometimes we will pull that person from government or from wherever it is they've been working successfully. We will convince them in the name of the Lord and ask them to give up their job so that they can become the hospital administrator or the hospital president. And when they come there, when it comes to budget balancing, then we distance ourselves from them. We kind of watch them as if they are going to be magicians who should find their own way to find funds. Remember, it is the responsibility of the board to help the president of the organization identify where money will come from based on the plans he gives to meet the strategic vision that you've given to him. If you do not balance a budget, you are going to frustrate your CEO. I have seen in my career time people who were very good lay leaders who we called to do these works who have left very bitter because they felt the church did not care. I don't know about the places where you come from, but in the places I'm familiar with, we would fly to this institution. We fly on the day, just the day before the board. Sometimes we would fly in the morning and the board is at 10 in the morning and we fly in at 8. We get to the boards and we start chairing the boards. It's as if we are not part of what they are doing. We just came to see, okay, how are you? We fulfilled the requirements twice, 2 times boards in a year. As board members, you have the responsibility to balance the budget and give to the president an enabling budget that will make him succeed. I'll go a little bit faster here. You need to appoint auditors. That's the responsibility of the board. You need to appoint auditors. Why do you want to appoint auditors? You want to appoint auditors, and in most of our cases or hospitals, maybe we use our own internal auditors, GCAS. But this is very important because you as board members, you don't work for the organization, and the only way you'll be assured things are going okay is by the audited reports, the reports that are coming from the auditors. When you appoint auditors, you instruct the auditors, these are the statements we will need. Beloved, let me say something. Even though our hospitals are meant for service, they are businesses. It's a business entity. You have employees. You render services where in most cases you charge. It's a business entity. You want to make sure you have internal controls in that hospital. You have everything that is proper. And that's why you have to appoint auditors to work with you. The decisions that you make are based on accurate information. The board is responsible to develop those policies that will maximize the performance of the hospital. That is your role. You think for the hospital and say, now, in the light of this, what policies will enhance us to do this? Most of our hospitals, for example, struggle with the issue of debt. We owe so much. Sometimes it's because our policies and guidelines of how we should charge for the services and who we should charge and how we should do that are very weak. I chair boards. I also teach sometimes at different schools. You know, I have had students in class who will finish a quarter before they are charged their tuition. I mean, the quarter is over. And then they're looking for, did we charge this? You need to make sure that you put in place guidelines, policies that will make the organization run. That's part of the work of the board. The board assumes success and failure. That's something we've covered. Board has the right to receive and interpret documents such as financial statements and audit reports that come. So let me talk about relationships with the CEO, most of which I have actually covered in my speeches. And I won't even spend a lot more time on this because I think it's something I have covered. You as a board, when you have appointed that CEO, you are standing behind this person because this is the person you have said, go and manage our $10 million. Go and implement our mission. Go and see to it that our vision is realized. Therefore, the board depends on the CEO for realizing the desired outcome of the organization. That is why the CEO needs to be given support from the board, because the board is dependent on how that CEO will perform. The CEO has abundant authority to manage the operations of the institution. You know, I have seen sometimes where a CEO is crippled, he wants to do something, and sometimes the board does not draw a line. The board is not supposed to be involved in management details of the organizations. Their influence over how the institution is managed is through policies and guidelines and the CEO himself. But they cannot start interfering in the activities of the organization outside of the decision-making arena that they have. They have to know that the CEO is their person. And then the board should trust the president as a capable person to accomplish the mission. There must be a trust. They must clearly convey expectations. Now, one of the most frustrating things is to work as a CEO and the board has not clearly articulated what they expect from you. That is a responsibility of the board. The board should hold the president accountable. The board should evaluate its CEO or any senior leadership according to whatever their system would be. Let me talk about this. If you were to imagine that your money, if that's what you had done, is invested in a company and there is this CEO who's managing your money, you want to evaluate the performance of that CEO so that you are sure what you have invested is able to come out as you want. The desired outcomes are realized. Evaluating CEOs is a duty of the board. I have seen evaluations everywhere where boards are and assume that responsibility seriously, but I have also seen that in most of our institutions, particularly in developing entities, we only come to evaluate the CEO during the nominating committee or during, in this case, when we are trying to re-elect or elect somebody else. On an annual basis, a CEO must be evaluated. Create an evaluation instrument that you will use for that. And then annually, you evaluate him, and when you get the results, you share with him. So this is how you are being rated in your performance. Then it helps that CEO to grow. It also helps you to know the weaknesses and the strength of the CEO. Membership and duties. Let me talk about the criteria for selecting board members. One of the most prevalent criteria in the Seventh-day Adventist Church for electing board members is sometimes the person is spiritual. And that's good. Nothing wrong with being spiritual. But I have also seen many spiritual people who come to boards for 5 years having said nothing in the board. I mean, absolutely nothing. They come, they are spiritual, and they pray for you, but they don't say a word. You are not appointed to board membership to just come and pray for the saints. And this is why it is important for you to use a good criteria to identify board members, some of which are, ask people, do you have time with you? If we elect you as a board member, are you going to have time? Sometimes I've seen us appoint very influential people in government, a medical doctor, this and that. We put them on the board, but they never show up for board meetings. And why don't they show up? They don't have time. Secondly, it is good to find members who have experience in dealing with boards. It is important for the people to know just how boards run and the rights and all of that is needed for boards. Quickly, people who are emotionally intelligent, people who are able to make a difference between issues. I have seen sometimes when you have people who are challenged in being emotionally intelligent, they can actually make board meetings turn into something of attacks. You are a board member to make decisions as a team. People with integrity, excellent communication skills, good interpersonal relationships, because you're trying to build a team. executive knowledge in industry. Let me make a comment on that. If you're going to be running a hospital, you do not want to fill your board with pastors only. They are good in the pulpit. We praise God for that. They are also good in visitations. That's their calling. But when you are dealing with hospitals, you want to have amongst your board members people who are able to understand the functions of hospital and the roles and how it relates to communities. Those are the people you want to put there. So it is important for you to make sure that you put people there who are knowledgeable in the industry. Diversity in thinking and skills. Many times we select board members, if that is our thinking, board members who will just say yes, because that is what we want. A board that is full of people who will say yes to everything the chairman says is not worth being called a board. Because if all you will do is say yes to everything, then you could as well just leave the chairman to be the only member of the board. You are a board member because you have to think and contribute to the discussions meaningfully. Bring who you are to the meeting so that people can know what you are bringing to the table. Ask questions. It's part of a health board. Gender sensitivity. We do very poorly in the ecclesiastical system on gender sensitivity. Sometimes you will see people coming from a meeting just dressed in black suits only. No red, no yellow, no green. Everybody is just the same. Remember, in your boards, in your hospitals, there are many women that are cared for. Make sure you reflect that. Reflect the diversity. Be sensitive to diversity and to gender. Now let me briefly comment on duties of a member of the board. I will comment on all of them by just listing them. You do have, as a board member, the duty of knowledge. You need to have knowledge about how things are run and the industry you are going in. The duty of care, that you care about the business of that entity. The duty of skills and prudence, the ability to have knowledge in this, have necessary skills that will make you a better person in serving as a board member. Duty of diligence, duty of manage, fiduciary duties, your obligation to be faithful and stand for that organization. The duty to avoid conflict of interest. Conflict of interest is one of the challenges, particularly in business boards, people who make profit, because if you are a board member and you have conflict with the business that you are a board member of, you need to declare that. You need to say, I can't vote on this because the company that I run competes with what we do. That's the duty to avoid conflict of interest. The duty to act within scope of authority. Let me come to a healthy and productive board in the remaining minutes. Number one, when you're coming to board meetings, come prepared. Attend meetings. It does not help you. You are a member of the board, but you don't attend board meetings. Attend board meetings regularly, because that's part of your duty. Arrive at the meeting on time. I'm laughing because we all just came from listening to Dr. Alan Handyside talk about cultural sensitivity. I am from a culture that works on events. But one of the things that I have come to learn, that I appreciate about the globality of the Seventh-day Adventist family, is that we can exchange and share values. While we are or while we may be a time-conscious culture, or while we may be an event-conscious culture, it is only healthy that when we are in the arena of business, that we are punctual to meetings. I have seen times when a person who's supposed to make a presentation at the meeting hasn't yet arrived. That is not going to make our institutions successful or first-class institutions. The society of people we serve is such that, just imagine with me, if you are from an event culture which says, I'll be operated on, the dentist will work on me. What if a person or your client is from a time-conscious culture and they say, oh, I have scheduled 4 to 5 for my dental appointment because that's what they gave me. Then they come to the clinic and you tell them, take a seat. And then they sit there for the next 2 hours. They will not come back to you the next time because you've just lost them because you've also not made effort to understand who they are. So I guess in this we have to both try to understand our people, the people that we serve. Quickly study the agenda and supporting documents ahead of time. One of the weaknesses in boards is you have people who come to the board and they have not even read the previous minutes. They have not even done anything. You are voting a balanced financial statement, or you are voting volumes of policies of which you have not even had access to. As a board member, ask for those things before you come to the board. As chairperson, as secretaries, provide those things to your board members in time. That way, they are able to review and understand exactly the issues that you'll be dealing with. It is not helpful for members to say, Mr. Chairman, I haven't seen anything on that. And then you say, you can go and read. But in the meantime, you ask them to make a decision. Read the previous minutes and bring them if need be. During the board time, more information, ask for more information if you don't understand. Do not make a decision you do not understand. Do not be personal in your comments. Always address the issues. Address the issues in your arguments and always think about the interests of the organization. Let me make a point on thinking about the interests of the organization. When you are coming from whatever business you are coming from as a board member, when you enter the board, your interests and thinking and basis of decision should be on the interests of that organization. They are the ones you've come for there. Focus on them because they are the ones that you are representing. If need be, let there be secret votes. Vote as per conscience. That is why you are a board member. We need to hear your voice. It is important for the board to hear the voices of the key people groups who work for the organization and constituency that it serves. Let me comment on this. I realized that one of the weaknesses that I personally saw as a chairman of several boards that I chaired, one of my weaknesses was when I went to an organization, I would only touch base with the top members of the board and the president of the organization. Then I would go. It's good sometimes for you as board members to come a day or two earlier and just walk through the hospitals. Just walk through. Sometimes go spend a night at that physician's home if that is okay. Just understand the people over whom you make decisions as a board. You might find that you will learn more and become more relevant and useful when you know the needs of the people that you lead. Let me close with a story of how important it is for you to know your responsibility as a board member and how you can get in trouble if you don't understand. And I'll make this the last story, then we will open up for questions or for comments. And we will have microphones available. One time we made a decision as a board of this institution. When we made the decision, it had to do with increasing salaries. When we increased the salaries of this particular institution, the division office heard about what we did. And the scale went off the scales the division wanted us to be in as an institution. And then they sent a message to us and said, what you have voted will not be honored. Okay, now it so happened that that board had 4 members who were government employees, and they were not Adventists. So those 4, the rest of us who were Adventists, knew that we had received an instruction from the division, and we know who the division are, we know they are authority, we know they are our bosses, we know they re-elect us. But those 4 did not. Those 4 had only one thing they were going by, the constitution and bylaws of that institution. So one of them raised a question and says, Mr. Chairman, you've just told us that the action we voted will not be honored. By who? And we try to explain, this is what came from this. They says, Mr. Chairman, can we draw your attention that in this board, we are authorized by the government of so and so to make our decisions final, and they are not subject to any other authority outside of us. To cut the long story short, the division gave us instructions. This institution stood by what it had because it operated on bylaws that gave them the authority. At the end of the day, the division had to back off. You can only work, and it so happened that the chairman of this organization was the division president himself. And so, at the end of the day, he also learned the lesson that you cannot call back a committee to comment on the activities of an incorporated entity. It functions as a board. Let's see if we can open up for the remaining 12 minutes for questions or for comments appropriate to the subject.
Thank you for your presentation. My question deals with your slide on audits. I work in the Inter-American Division Union, a division. We have spent many hours talking about the inability to be audited. So my question is, how does the board schedule an audit?
Okay, thank you. Several of you could comment to that. I'll give you a practical response of how that has been managed by some. The challenge we have is most of our hospitals are audited by GCAS. Now, GCAS has so much work, they cannot manage to audit every institution. And yet, you need to be audited for you to make appropriate decisions. One option you can select is to ask for permission from whoever to say, we would like to employ an auditor, particularly to do an audit for us if the statements are, if the board values these statements, they can actually ask for an external auditor. As long as they work with the organization, so we want to do this because we don't have a scheduled audit. I haven't seen resistance to that. Did you want to comment on that? It's a separate question, okay? Please.
Can you? Okay, that's fine. Yeah. Thank you for the presentation. I just want to seek some advice. I'm not sure, your slides are not numbered here, but it's the one on criteria of selecting board members. Mm-hmm. So I wonder, what advice would you have for a CEO who comes in and finds an imbalanced board? As you have taken us through that, and that's generally what happens, that the CEO would have been selected by the board. But now you come in as a CEO appreciating all the things that you've just said, and you find you are the CEO for a hospital, but your board is all pastors. What advice then can you give for that situation?
Thank you. If you come in at a time at which you cannot change the board because the board has been duly constituted, just start negotiating your way now with the appropriate authorities that at the next time when you have a chance, your board is changed. But let me also say this, leaders, one reason why this conference has been called is for those of you that chair boards, those of you that form boards, to be sensitive to making sure your boards are balanced, that they follow a criteria that will help you. Remember, if your board is not a good board, you will not govern the institution very well. It's a very practical observation. Many times we run into that, and the CEO struggles. But the truth of the matter is the CEO is a servant of the board, so he can't change the board because he's just a secretary, and he's a servant, really, of the board. So those who constitute the board are the ones who should be educated on how to put up a board. Okay, I'll follow by what?
I'm Dr. Kahilig from Calbayog. I think one of the primary reasons we're having some difficulties at times is how we constitute the kind of skills, the kinds of mindset that the nominating committee gets into the board. So I think there has to be also a way in which we could be able to determine the capabilities, the skills, the mindset of the people that we are going to appoint to the board. And that would mean having to work with the nominating committee in order to have the right balance of skills, of mindsets, and not necessarily just having a board filled with pastors.
Thank you. Let me put forth a very practical suggestion. As CEO, because remember, you are the one who has on your uppermost mind the welfare of the institution. You are the one accountable to the board. Once you are appointed CEO, here's a practical suggestion. Develop a criteria for the selection of board members and take it to the chairman of the board and say, Mr. Chairman, the next time they are trying to compose a board, we would like them to follow this criteria. Can we vote it as a board? Are you with me? If they vote those guidelines as a board, and then they pass it on to those who compose the board, then the board composers are bound to follow the suggested guidelines. At least do that. It's one practical way. Okay, I saw another hand. Okay, please.
Thank you very much. I don't know whether, correct me if I'm wrong, in a hospital board, I've always found out that it is an unwritten policy that the chairman is the president of the conference or the president of the union. And the other members is the secretary of the conference or the union and the treasurer. While the secretary to the board is the CEO of the hospital, plus the matron and the chief financial officer. Now,
as invitees in most cases.
Now, the rest is those lay persons, which leaves about 3 lay persons to be members of the board. However, in most cases, I found out that those 3 persons are chosen by the president of the union or the conference to be pastors.
Yeah.
Is that a policy, or is just the choice of the president of the union or the conference?
Thank you. It is at different levels. I would almost view it as a policy or as a tradition. For example, at the general conference level, institutional boards are traditionally and actually constitutionally they are, within the constitution of different entities, they write there, the chairman shall be a general vice president from the general conference. Like you find Loma Linda at Andrews University, Oakwood University, all these. They have that. As a result of that, it has been carried as a tradition, or I don't know if it's even written, that union presidents therefore serve as board chairs of their different boards, hospital boards, ADRA boards. Now, there's a reason for that. The reason is that while the the institution, the hospital, is a standalone, it needs to have ecclesiastical input because its parent organization is the Seventh-day Adventist Church. When you look at our beautiful statement here at Loma Linda, you see Loma Linda Medical Hospital, something like that. Then it says a Seventh-day Adventist institution. I think they do that to make sure that there's connectivity. But it is not a rule that the chair should be a union or conference president. However, whether he is not the chair, whoever is appointed will pass through, in most cases, the executive committee that composes that. But then there's another thing that they can do, or that can happen. You don't have to have all the officers as board members and then the pastors. That is where education and sensitivity comes. And it is just to the good of the organization not to fill it with pastors. Now, those who are pastors, if you were to ask them and say, how would you feel if the executive committee was to be filled by medical doctors? Your committee, your conference committee. If it had to be filled with medical doctors, you would definitely sense that this is not healthy because your primary business is ecclesiastical business. Therefore, if the business of an entity is medical care, I think those who are medically informed should dominate in that board. That's part of the education we have to have. Okay, please.
Good morning, sir. Okoro from Nigeria. I want to thank you for this presentation. You can see that everybody here is concerned about the criteria for choosing members of the hospital boards. And that has been the bane of management of hospitals all over the world. You see,